So today I'm going to talk to you about injury and rehab, when to use massage and how massage can help, as well as kinesiology tape. So when I say injury, what do I mean? There's a couple different kinds. In the case of impact injury, you are hit by something or you hit something else. And in that case, there is a date and a mechanism of injury, which are very helpful to know. Same thing in the case of surgery, which absolutely is an injury. Surgery is a huge insult to the body. We know what happened and when. In the case of overuse or repetitive use injury, we know what's happened, but there's no specific date because it's happened over time. And then in the case of an unknown injury, something's hurting or something's not moving quite right, but we don't really know what's happened or when. So the phases of injury, this is mostly relevant with impact injuries and surgery. Your body goes through this repair phase. The acute phase, the inflammatory phase, that's where all the swelling happens, and that's the first 4 days. Then you move into the subacute, the repair phase, which lasts from day 5 to day 14, and then the post-acute, which can last from day 15 all the way up to 24 months. So sometimes it takes a really long time to rehab and get you back to where you were before. Anything over 3 months is considered chronic, so that's where a lot of your overuse and your repetitive use injuries come in. So why is that important? Well, depending on the type of injury and which phase you're in, massage, there's things that we can do to help you. With overuse and repetitive use injuries, we can jump in right away. There's a lot of things that we can do right out of the gate to help you get to feeling better and get back to where you want to be. In the case of impact injury or surgery, where you're in that acute phase, not always, but a lot of times we don't want to do too much to interfere with that process. As uncomfortable as that is with all that swelling serves a purpose, and we really kind of want to let the body go through that. Not always, like I said, but generally speaking. Then we move into the subacute phase, so from day 5, now we want to jump in and we want to be pretty aggressive. We want to get that swelling out of there, we want to flush that fluid out, work on range of motion and movement. A couple of things to note: if you have been using ice or NSAIDs, which are your Motrin and your ibuprofen, they can help you feel comfortable in that first phase. They certainly can. But then once you get into the phase where your body's trying to repair itself, they become a hindrance. And we generally advise people to discontinue those if possible. The other thing to note is that it's critical to put the tissue through motion beginning on day 5. So that shouldn't be painful. Sometimes it's uncomfortable because your body is guarding. It doesn't really want to move. It's hurting. But the movement that we do with the tissue doesn't cause pain. And then phase 3, you just continue to work on adhesions, range of motion, and increasing the intensity of all the things that you've been doing to rehab until you get back to where you want to be. So now let's talk about kinesiology tape. The health community is kind of all abuzz about K-tape. So I just want to clear up a few things. What is it? How does it work? Kind of what's the big deal? If you watched the Olympics last summer, or if you watch any professional sports, you've probably seen the athletes wearing the brightly colored tape. That's kinesiology tape. So this is called strapping. This is what boxers do, some other kinds of fighters. This taping method is designed to restrict movement to prevent injury. So this is not how kinesiology tape works. K-tape works not only with your body's movement, but to facilitate movement. So 2 different goals here. So how does the tape work? 2 ways: biomechanical lift and recoil. So with the biomechanical lift, and I hope you guys can see this, the skin is here, and then this is the muscle down here, and all this stuff here, this is the interstitial space. So in here, we've got all of your sensory receptors, including your pain receptors. So when you have an injury and that area is filling with fluid or blood, if you think of like a water balloon where it's filling, getting fuller, and tighter, that's happening in that space. So now you have 2 problems. One, that fluid is compressing your pain receptors, which are triggering them to send messages to your brain that you're in pain. And then the second thing that's happening is you kind of have like a traffic jam. There's just too much fluid in there and the body can't pull it out and process it like it's designed to do. So with the tape, as you can see, the tape lifts the skin, and now you have all this space in here. So you've done two things. One, you've immediately alleviated that compression on those pain receptors, which has stopped triggering them to tell your brain that you're in pain. And the other thing is, you've alleviated the log jam that was happening. So now the body can pull that fluid out of there and process it like it's supposed to. So this is a client of mine. She came in 5 days after her injury. As you can see, she rolled her ankle playing softball. So you can see this is horribly bruised, but look at the circumference of her ankle. It's huge. So we taped her that day. 3 days later, she came back for a follow-up. We took the tape off. You can see not only is most of that bruising recovered, but the size of her ankle is back down to where it should be. So the tape did what it's supposed to do, and it helped to pull that fluid out of there. That's 3 days. Here's an example with a bruise. You can clearly see where the tape was laid down over that bruise, and the body was able to pull that material out of there like it's supposed to do. The second way that the tape works is in the recoil. So if you think of a rubber band, if you stretch a rubber band and you anchor one end and then let go, it's going to recoil towards the anchor. So this is the same mechanism that we use with the tape, and we use it to either increase or decrease the tone of the muscle. So this is why, clients come into my office and they say, I bought some of that tape at Walgreens and it doesn't work. Well, you can't just slap it on. You have to know which muscle you're targeting. You have to know the origin and the insertion of that muscle. And then you have to know how much tension to put on the tape. So it has to be applied correctly. And when it is, it works. So when do we use the tape? As I said, there aren't a lot of cases where we want to jump in that acute phase. Generally, we want to wait till the 5th day and later. But we can use the tape for swelling, for pain applications, and then for changing the muscle tone itself. So a couple of things, these are, I've had this up before, these are all things that I focus on. A couple of just general notes. If you have an appointment already and you become injured, or you have a flare-up of your injury, don't immediately just cancel your appointment. Come in. There's a lot of things that we can do to get you feeling better. If you don't have an appointment, call. I'm going to ask you some questions trying to determine the mechanism of injury and where you are in that injury recovery phase. But there's a lot of things that we can do if you come in. The other thing I want to say is that I focus a lot on injury rehab here. That's definitely my wheelhouse and the thing that I like to focus on, but that's not all I do. You don't have to be injured or in pain to come see me. There's a lot of things that we can do for general maintenance and wellness just to keep you feeling good. So, does anyone have any questions? Yes. Yeah.
I just want to say that tape, you're absolutely right. You taught my daughter how to put the tape on her knee, and her swelling to me and her has significantly reduced. I know you've seen it.
Mm-hmm.
And I mean, it's just amazing that no one taught her how to put that tape on correctly, and you're the one that did it, and it's just amazing, that transformation of her knee.
Right. Yep. Yeah.
So I'm working out again.
Okay.
Like I'm doing, my body is just so sore.
Yeah.
I can barely put on my jacket for like almost 2.5 months. Definitely not a deep tissue massage. Well, what can I do to get through that phase? I mean, even stretching is hard.
Yeah, and with your stretching, you absolutely can't ignore it because your muscles will just get shorter and shorter as Right. So even though it doesn't feel really comfortable to stretch, you want to do it until you get to that point where you're like, even if you can't do very much, do some stretching. Other things that you can do when you're starting a new workout routine, I'm a big fan of Epsom salt baths. So the way that Epsom salt works is you have to use enough salt, first of all, and soak for long enough, but it leaches the lactic acid and the other things that are building up in your muscles, which is why your muscles hurt. That's the lactic acid buildup. So it leaches that stuff out through your skin, so you feel better. You can use ice. I don't ever really recommend ice. You can use heat. Heat would actually be better. And then massage. Just when people start a new routine, I always kind of suggest they up the frequency of their massages. We can do a lot of recovery stuff that will help you just get through that initial phase a lot quicker. So, okay. All right. Thank you very much.